Welcome to the Lifestylist Podcast, Harry.
Thank you, Luke. It's been nice getting to know you over the last few month or so, and welcome to Park City.
Thanks, dude. I'm having a great time. So I landed yesterday in Salt Lake City, came out here and to Park City and went to a hot springs nearby and had the most amazing time rolling around in the mud, covering myself in mud, jumping in the snow. It's like I'm having the best time because I wanted to get in some fun before I came in here under the knife. So I'm a little nervous about today. So this will be like the first interview that I'm nervous about for reasons other than the fact that it's just an interview and I don't want to screw it up.
Darling, don't be nervous.
But here we are. So why'd you end up in Park City?
Well, you just named it. It's awesome here. It's unbelievable.
That's why.
I mean, how many places in the world are you in a ski resort in the mountains and 30 minutes from a major airport?
That's true.
I can't think of one.
That's true, yeah.
I mean, it's phenomenal here.
So I'm originally from Aspen, but that's kind of a dinky airport.
It's a terrible airport. It's it's the highest plane crashes in the world or something.
Are you serious?
Yeah.
Don't tell me that. That's where I fly into.
Yeah.
I've been flying in and out of Aspen since I was a little kid.
No, Park City's one of the United States' best kept secrets.
I'm sold. Well, not anymore, maybe after everyone hears and sees this. I thought you might have based your practice here because so many people hurt themselves skiing and snowboarding that it's like a cash cow because everyone gets so jacked up on the mountains here.
Yeah, well, it's really just a suburb of Salt Lake City.
Right.
So many of our patients fly in from out of state. We're literally 30 minutes from the airport.
Right.
So that's it's a terrific place to live.
Well, I'm glad it's here. I mean, most of the doctor visits that I have are like right down the street in Beverly Hills, and you're still in the city, and it's not chill at all. So let's jump right in. What the hell are stem cells?
Our body is comprised of many cell types, and in every structure in our body, we have stem cells. So all our organs, all our joints, all our musculoskeletal tissues, every organ in the body that contains cells contains stem cells. And every cell type plays a role. Muscle cells are for moving your skeleton. Ligament cells are for stabilizing the skeleton. Stem cells, their job is to maintain the health of their microenvironment. What makes a stem cell is they have the ability to do two things. One is they have the ability to turn into new versions of themselves or turn into versions of target tissue cells. The second thing they can do is they release proteins. They're able to communicate with cells around them, and they're able to identify when cells have been injured and are damaged and are dying, and they release protein to signal those cells to heal themselves. So whenever you have tissue healing after injury, of any type of injury, that is a stem cell mediated event.
Interesting. So they go on little rescue missions, essentially.
Precisely.
Okay, awesome.
They're your body's own natural drugstore.
And we're going to talk about the efficacy of working with stem cells, but I've always been curious why the FDA is so paranoid about this division of medicine. Is it because that they can't patent stem cells and make a drug out of it? Like, what's the deal?
Well, there's the role of the FDA, and then there's the role of the pharmaceutical industries. Right. And you would think the two would be completely separate. Unfortunately, theoretically they are, and then in practice they may or may not be. Right. But the thing that's unfortunate is the FDA is set up to regulate food and drugs, and that's what they're set up for. And they have very distinct pathways to do that. Stem cell medicine does not fall into either of those categories. It's neither a drug nor is it a food. However, just because there's really no other body to regulate cellular medicine, the FDA is sort of taken charge of cell medicine because there's really no other group that would be appropriate for it.
Oh, it's kind of a gray zone then.
It absolutely is, because
like smart drugs are like that too. They're not legal, but they're not illegal. It's weird.
Well, this is a surgical procedure.
Yeah.
So, you're coming to me, we're doing a liposuction. We're isolating the stem cells from your fat. We're doing a bone marrow aspiration.
We're sitting here in scrubs, by the way, those of you listening.
We're in my surgical suite in Park City.
In case I forget this question, so we're getting stem cells out of my fat. Can you do lipo from my gut and give me a six-pack while you're at it?
Absolutely. I take requests. Sure. And he hasn't eaten, by the way, so he's being sedated.
I'm kind of, I'm a little bit goofy due to that fact. What are the risks involved in somebody getting a procedure done,
Well,
if there are
the
any?
main risks are anything that go along with any medical procedure because there's a liposuction involved. Very safe. There are some risks involved, not super dangerous ones. I mean, if done improperly, there's potential for real risk. Bone
Right.
marrow aspiration, way scarier than it sounds. Way more intimidating than it actually is, even painful. Very simple to do. I've done over 4,000 of them.
I feel safe. I'm in good hands then.
Yeah. Apart from that, I mean, the biggest risk, anytime you put a needle in somebody, there's always a risk of infection, which is a very serious risk. As long as you follow the rules, that risk is infinitesimally small. And so we just follow the rules.
So I'm gathering that tomorrow, while I'm still full of holes, it's a bad idea to go jump in a bacteria-laden hot spring.
Correct.
Okay, just checking. What are the conditions that are most often improved by stem cell therapy in your, branch of it?
Sure. So stem cell medicine is being used for just about every type of illness imaginable. Here at Doceri Clinics, we only treat one thing. We treat musculoskeletal pain, chronic musculoskeletal pain conditions. So about half our practice is spine, treat a lot of low back pain, neck pain, post-whiplash syndrome, dehydrated discs, which is what we're going to treat with you. And then the other half of the practice is treating peripheral joints. So hips, knees, ankle, foot, shoulders, elbows, hand, wrist. And the most common thing that we treat is arthritis, which is just garden variety osteoarthritis, degeneration of the moving parts.
And you're obviously having a lot of success with that because we just went upstairs to your upgraded office, which is, what'd you say, 2.5 times the size of this one?
Yeah,
and this is
right.
a huge clinic. So
yeah, we're moving up to the third floor.
You wouldn't be getting repeat business if it wasn't working, I take it,
Well,
do you get a lot of business, by the way, just from referrals? Someone said, "Oh, I had a bum knee and I went and saw Dr. Harry and I'm good now." And then
what's
their
interesting
family comes.
about our practice, and the reason I'm here doing this podcast with you, Luke, is because we actually don't do a lot of repeat business. We treat people once or twice, and then I got to wait for them to injure themselves again, or I just ask them to refer their friends to me, which is really, I mean, I'm dependent on a constant flow of new people because we do 1, 2, sometimes 3 treatments, and then either I didn't help them at all, or the job's done and they're better. So
Right.
we yes, we get a lot of
In
word
one
of mouth
sense, it's kind of a
referrals.
bad business model when
It
what
really
you're doing
is.
works.
I know. In my
You can't-
business,
it's not like therapy where you're like, hey, you still
Right.
haven't gotten to the root of all your childhood
know.
issues. You better come every
know.
week for the next 10 years.
well, and my business advisors are constantly saying, "Hey, you got to sell them on a package," and a lot of places do that. They do packages, and I hate that stuff. I mean, my goal is to see somebody as few times as possible, get them as much benefit as I can, and as few encounters as possible.
I love that because I don't want to go under 5 times. I hope we can bang it all out.
In classical Chinese medicine, the belief was a busy doctor meant he was a bad doctor.
That's great. I've never heard that. Totally makes sense, though. So with the stuff that I'm having done, for example, on specifically the hip and the spine, which those of you listening, if you've heard my show a number of times, I'm always whining about my back because it's like I'm so healthy, I feel so good, but my back has just been a constant issue. But I'm wondering in terms of, aftercare and things like that, if you're sending these stem cells in and they're going, hey, there's something wrong here, we're going to fix it. What do you recommend or how necessary is body work or physical therapy or, working on your mobility? Say once you get the stem cells into a hip joint or into the spine, it seems that with me, I just have structural issues that are jacked up, which I've been working on, honestly, not with that much dedication and commitment, but now I'm going to, now that I'm like spending some money, I got some skin in the game. I'm like, called my brother who's a mobility expert. I'm like, when I get back, we're going full on because I don't want to waste this treatment. But what happens if somebody just does not change their lifestyle and their movement and work on their mobility and just get stem cell treatment thinking that's the end
they're
of the
going to get
project?
short-term results. We're going to help them in the short term, and they'll, it'll work for a year or two, and then probably it's going to come back. I am a naturopath. I'm a naturopathic doctor. I'm not an MD. So the foundation of my training is in holistic medicine. It's the 4 pillars of health, which is diet, exercise, sleep, and having a balanced emotional life. So absolutely, those things must be addressed. But in your case, for instance, we have to have those 4 pillars of health. But I printed out your MRI. And so those of you watching can see this. Those of you who are listening, I'll describe what I'm looking at. But this is a T2 weighted sagittal view of your low back. And if what you see is I'm looking at your intervertebral discs, and the upper ones are white, 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 and what that means is they contain moisture, they're hydrated. And then the L5, L4, L5, and L5S1, the two lowest levels are gray, pretty much black, and then the next one is gray. So what that means is those discs are dehydrated.
They're also misshapen and all smashed. Like the ones
they're
above, those four above, have a nice
Yeah.
little sort of bubble
Right.
shape to them, and
They're
those lower ones look
degenerated.
jacked
Right.
up.
Right. So all of the diet, exercise, sleep, and balanced emotional life in the world isn't going to do anything to hydrate those discs, and that's where
Right.
we come in.
And neither is yoga, because I've been doing yoga for
Right.
20 years,
Right.
and it has not improved my back at all.
Yoga is going to strengthen your core. It's going to improve your posture. It's going to improve the health of the connective tissue. It's going to do all sorts of things. But in this type of case, that's where you really need somebody like me.
Yeah, I think the root of my troubles, and I forget if I mentioned this to you on the phone, but when I was in my early 20s, I was pretty wild, and I used to like to go hiking, which is great, would be healthy, but I used to get drunk and go hiking. And so I years later remembered, oh yeah, that one time I was hiking drunk up in the Angeles Crest Forest outside of LA, and I did everything drunk, to be honest, but hiking just happened to be one of those activities. And I came home that day and I couldn't walk. Like one of my right leg was up higher than the other one. I developed like instantaneous polio. And so rather than going to a doctor, because I was like, screw doctors, man, I'm rock and roll, I don't go to the hospital, I had my building manager, who incidentally looked exactly like Steven Seagal, like twin, and I had him take a rubber mallet.
So you had an enormous ass.
Yeah. I had him take a rubber mallet and smash the side of my hip to like knock it back into place, and that was my my physical therapy. And
Luke, you're a real rock and roller.
Yeah, I was a real dumbass. And so after that began this this increasing hip pain, and then that kind of pulled on the lower back, and I lost mobility. I literally don't have a hip. It doesn't move. I have no ability to to move the hip like a joint should function. So yeah, it's not cute. So aside from this type of pain management and repairing joints and arthritis and all of this stuff, I'm curious about some of the other uses of stem cells. Like, does anyone ever get stem cells shot into their brain?
Well, as I said earlier, stem cell therapy is being used for pretty much the entire spectrum of medical conditions, for neurodegenerative diseases, for autoimmune diseases, for pulmonary, for cardiac. I mean, if you can think of a condition, there is somebody who is currently researching it with stem cell therapy. As far as injections into the brain, so there's three ways to get stem cells into the brain. So first of all, let me just talk about, we talked a little bit about stem cells, and then this, the two actions of stem cells. One is this ability to differentiate into target tissue cells that have been injured. But really what we think is the much more important of the actions, and this is going to come up later when we talk about exosomes, is the stem cell's ability to communicate with other cells through these signaling proteins. We call that a paracrine effect. So cell-to-cell communication is paracrine communication. And the way they communicate is with these growth factors. The cells themselves are not able to permeate the blood-brain barrier. The growth factors, however, are able to permeate the blood-brain barrier.
Are the other cells not able to because they're too big?
They're too big, yeah.
Oh,
they're much
interesting.
larger. If you look under a microscope, you see the platelets are these tiny little things, and then red blood cells are a bit bigger than that, and then white blood cells are quite a bit bigger than the red blood cells, and then the stem cells are enormous compared to the white blood cells.
Oh, interesting. Okay.
So yeah, they're far too, and the blood-brain barrier is just big enough to, it's too large for them to travel across. So the three ways to get stem cells to the brain and growth factors are: you first, if you're giving the stem cells intravenously, first you preload with a medication called mannitol, which is just a sugar. It's used in the emergency room for people who have intracranial pressure. So they've had a traumatic brain injury and they have swelling in their skull, in their brain. And you give the mannitol, and it temporarily renders permeable the blood-brain barrier.
Oh, wow.
So that's one way to get stem cells and growth factors to the brain. The second way is you inject directly into the cerebrospinal fluid. It's called an intrathecal injection. I'm not a huge fan of the intrathecal injection. There's some definite risk involved, and there's really not a lot of data showing that there's any advantage to doing that over giving it intravenously. And then the third way, which I think shows tremendous promise, is that is an injection directly into the brain through what's called an Ommaya reservoir. So in this case, a neural surgeon drills a small hole in your skull. They place a needle directly into your brain, and they inject the stem cells as such. Now, this is not something that I do here. This is not something I ever plan to do. However, there is a doctor in Los Angeles. His name is Chris Duma. He's part of the network that I belong to, the Cell Surgical Network. He is a neurosurgeon. He is treating advanced Alzheimer's and cognitive disorders such as, I had a stroke a year ago, which is a big part of my story, but I have a little trouble with word recall. I had a bacterial infection in my heart.
I heard that.
Yeah. So dementia, that's the word I'm thinking of.
Yeah.
It's pretty scary when you can't remember the word dementia.
Welcome to my life, dude.
Yeah, seriously.
That's why I take a lot of nootropics. I need a lot of help. Yeah.
Seriously. So he has a small number of patients that he is showing that he is actually reversing dementia and Alzheimer's.
Oh man, that's so cool. I actually know someone with Alzheimer's. I'm going to share that information.
Yeah, Chris Duma.
Cool. We'll put all this stuff, obviously, you guys, in the show notes. There's going to be a lot of resources mentioned, and you'll want them later. So keeping with the head then, I want to just cover a couple more things really quick. Anyone getting any results with hearing loss, tinnitus, that kind of situation?
I've had a small number of people I've treated for musculoskeletal conditions, and we always give a little bit of stem cells intravenously. And I've had a couple of people tell me it has helped with their tinnitus, but I've never treated tinnitus directly, so
Right.
I've no experience.
Oh,
with
I
that.
hope I get that side effect because I have it right now in my left ear. It sounds like a party going off in the other room, like a really loud whistle sound. It's been driving me nuts. And then how about eyes? I've heard some stuff about macular degeneration being assisted with stem cells. I know this isn't your area of expertise, but just, do you hear around the campfire of you and your fellow stem cell experts?
The group that I belong to is called the Cell Surgical Network, and their website is stemcellrevolution and .com. And they have it's a big network of doctors who treat all sorts of different things. And yes, there are docs in that network treating macular degeneration along with other ocular disorders.
When they do that, do you know if they shoot it like right into the eyeball?
I think most people are doing it intravenously. There are a small number of eye surgeons that are injecting directly into the eye. If you have that done, I would strongly recommend going to an eye surgeon.
Right. Yeah, that sounds scary. But the reason I ask is my dad has it, and my vision's gotten weird lately, so I'm always looking for cutting-edge solutions on that. And then you mentioned doing the intravenous delivery. Is that something that I'm going to do today?
Oh, absolutely. Whenever we give somebody stem cells, we always give a little bit intravenous because why not? I used to only do it when it was indicated or if people requested it, specifically if they requested it without me offering it. But I had a friend of mine who's another stem cell doctor. He said, man, you should just do it with everybody because, what harm is it going to do? And it might do some good. So I always tell people about it and offer it to them, and pretty much everyone accepts it. One person didn't, but
is there? Have you gotten results in terms of immune system modulation from doing the intravenous?
We've had people tell us all sorts of interesting things. Again, I really focus my practice on the treatment of musculoskeletal pain. Right. I don't step outside of my area.
Right. So if somebody benefits from an IV that you do, and it's like, wow, my tinnitus went away, or whatever, my vision's better, whatever, it's just kind of a fringe benefit.
Yeah,
it's not your intended goal.
Exactly. We've had a couple of people with, for instance, exercise-induced asthma who've quit using their inhaler. But again, fringe benefit.
Yeah.
That's how I'm going to refer to it from now
Okay,
on.
cool. I like that. And then what's the difference between the fat-derived cells and the bone marrow cells? Seems to be a lot of debate around which one's better. I know you do both because you're just like, cool.
Right. Well, the thing is that, you see a lot of information on the internet, and you see a lot of mudslinging. You see a lot of, people who do bone marrow saying that fat is, unproven, and then you see people doing fat saying bone marrow is barbaric. And, the fact is, my experience from listening to these arguments go both directions, is that the guys who like doing bone marrow tend to tear fat apart. And they tend to be the guys who have no experience with fat. Similarly, the people who do fat like doing fat and they don't want to do bone marrow. And they are the ones who tend to, tear bone marrow apart. I started out doing bone marrow.
What bone do you get it out of?
The iliac crest, so the big flat bones in your pelvis,
Gotcha.
the frisbee-shaped bones in your pelvis.
Before I forget, when you do mine, can you do it on the left bone?
Sure.
My right side is so jacked up.
I usually do the left anyway.
You do? Okay. Yeah. Makes me paranoid. Carry on.
Sure. I started out with bone marrow, and then I started using fat. When I started using fat, what I did is for a period of 4 months, I would offer people, would you rather do bone marrow, or would you rather do fat-derived stem cells suspended in platelet-rich plasma? And what I did is I then followed up with these people. 6 months after their treatment, I called them and asked how they were doing. So 6 months and 1 year. And what I found was the people with whom I did bone marrow, as had been my experience the years leading up to that, had consistently good results at about a 10% non-responder rate. The people I did fat suspended in PRP, when it worked better than bone marrow. But now my non-responder rate was up around 30%. And I don't know why that is. I mean, that could have been something I was doing wrong. I really don't know. But that was just my experience. So then I started combining the two. And I started calling people at 6 months and 1 year after. And what I found was when I did the two together, I seemed to get the consistency of the bone marrow with the augmented improvement of the fat. And I have this data published in the Pain Practitioner, which is the journal of the American Academy of Pain Management. It's on my website.
Wow, awesome. And you mentioned PRP, or platelet-rich plasma. Can you explain to our people what that is?
Sure. Platelet-rich plasma is another regenerative modality. So instead of using bone marrow or instead of using adipose-derived stem cells, we're just doing a blood draw, concentrating down putting the blood in a centrifuge. The red blood cells all go to the bottom because they contain iron. They're the heaviest. The serum goes to the top. That's the lightest. And then in the middle is called a buffy coat. And in the buffy coat, you find the white blood cells, but you also find the platelets. Platelets are what signal your own stem cells to activate.
Oh,
and
wow.
for years, from 2006 to 2010, my practice was 100% platelet-rich plasma. Then bone marrow came along. I started doing bone marrow, and it worked so much better than PRP. I transitioned over to that.
And now you're still including, in certain cases, PRP mixed in with the stem cells?
Occasionally I do. I work with Dr. Keelan, who you're going to interview next, and you're also going to be treated by today. The advantage of PRP when you're using adipose-derived stem cells is you can isolate it so there's no red blood cells. So especially when you're doing the cosmetic injections, you don't look like you went through the windshield of a car. So it's actually better to use PRP.
Yeah, it's just a shout out for PRP. I've had that on my back and hip, and it didn't help at all. But I had it, I think, 2 treatments in my wrist and elbows because I was getting like weird computer carpal tunnel-y kind of stuff. And within 3 months, it went away and never came back. And I still use computers like a madman. Great. So I'm for it for certain things for sure. But yeah, the back, it didn't really touch. So what's the deal with the different types of derivatives of stem cells? There's umbilical ones. There's fetal cells. I think a lot of people are confused perhaps about if we're harvesting aborted babies and just weird Frankensteinian kind of stuff there. So where do they come from if they don't come from your own body?
Sure.
And how are the U.S. laws currently with that whole thing? Because I know there's a lot of stem cell tourism in places like Panama where they can do weird stuff that you can't do here.
Right. So just a little vocabulary lesson. So we've got autologous stem cells, which is stem cell. The word autologous means donor and recipient are the same person.
Got it.
So autologous stem cells are stem cells from your body. So that's using your bone marrow and using your fat. Autologous or allogenic stem cells are when it's from the donor and recipient are different people. So that's when you're into the umbilical cord, the placental, the amniotic membrane, that sort of thing.
Okay.
So currently, there are a number of labs in the United States that produce products both with stem cells and without stem cells. So essentially what they do is they recruit these women who are scheduled to undergo normal, healthy births. They screen them for every imaginable communicable disease and genetic disorder. If they pass all of that, they then have a rep present at the birth. The woman gives birth to the baby, has her baby normally, and the rep takes possession of the placenta and the umbilical cord. They buy it from her.
Wow.
Then they
I wonder how much they get for it.
I always want. I mean, it was
It
to
must be
ask
a
that.
decent amount of money if a woman's like
Probably.
willing to even go through with
Yeah.
setting that up.
Yeah,
you
I've
know?
never asked. I always mean to ask, and I always forget
Yeah.
when I talk to those guys.
Yeah, I wonder if the kid gets a cut later on, goes in the
that's
college
right.
fund.
That's right. That's right.
Their first car, you know,
Right.
here's your BMW. That was, you know, anyway.
So then they screen those tissues for every imaginable disease and genetic disorder, and if they pass all of that, they freeze the stem cells. They isolate the stem cells and freeze them. They also take the tissues, the acellular tissues, the part like for instance, the Wharton's jelly. Wharton's jelly is the insulative layer of the umbilical cord that's made up of human-derived hyaluronic acid and chondroitin sulfate.
Ooh, that's good stuff for joints,
Precisely.
Nice.
They freeze that stuff and then they sell that to guys like me, and then I have the option of using them with guys like you.
Are we going to do that?
We're going to use exosomes today.
Oh, okay. Oh, yeah, which we're going to get into. Okay, cool. So what's the deal with the tourism factor? Why do people spend time and money going to Mexico, Germany, Panama, etc.? Is it that they can culture and multiply the stem cells and make more of them? Is that the...
Right. So the big thing that you can do internationally that you can't do here is you can culture expand these cord blood cells. So you take these umbilical cord cells and you put them in a lab and you grow them like crazy. And now you have, you know, instead of like the vials that the lab here in Utah sells me, it's 1 million cells in a vial. Well, you know, it's still pretty expensive. Well, for the same cost, you could have 100 million. So that's the big advantage.
Is more better?
Theoretically, yes. We don't know with complete certainty, but there are a small number of studies where they do dose-dependent treatments. So, you know, one person will get 1 million stem cells, the next person will get 10 million, the next person will get 100 million, and it does seem that more is better. Now, exosomes might
let's
turn
cover
this
that.
around.
Let's cover that.
So
yeah.
the exosomes
This
are
is
the new
interesting.
kid on the block. This is something that I'm just starting to use. I've heard about them for a couple of years, and I always wait. Even though I'm an early adopter, I try to stay on the cutting edge and off the bleeding edge.
I like that.
So,
Off the bleeding edge. Yeah, that's funny.
So, I mean, I've known about exosomes for a couple of years now, and I've just waited for enough of my friends to do it, and that I feel comfortable doing it myself.
Right.
So, what exosomes are, and it's really fascinating. So, you have a stem cell, right? And then if you look at, remember your biology 101 textbook, and it shows a cell, and it shows the nucleus, and it shows the Golgi apparatus, and it shows the mitochondria, and it shows, all the different organelles of the cell. Well, one of the organelles are what are called exosomes, and they're these little vesicles. It's these little bags of stuff. And when I was in school in the 90s, we used to think that it was how they would excrete metabolic waste. We didn't know what they were. People had seen them, but they thought that was how a cell released its waste. Well, actually, that's how a cell releases these signaling proteins that then trigger the paracrine effect. That tells the cells to heal, to go into a healing mode. So the way that exosomes are made is you take placental stem cells, you culture expand them, then you put them in a stressful environment. So now the cells think their host is under duress, and they start creating these exosomes. They start manufacturing the exosomes in order to help their host. And then they lyse the cell. They destroy the cell and harvest the exosome. Now you have arguably all the benefit of culture expanded stem cells without the stem cells. So now you've just sort of bypassed that whole regulation about, in the United States, we're not allowed to culture expand umbilical cord or placental cells. Well, now you've culture expanded them, but then you've destroyed them. So we're sort of one step ahead. the FDA.
That's punk rock. I like that.
Yeah, I mean, it really is. I mean, there's not really any ruling on this because it's so new.
I'm still like a teenager. I hate rules, you know.
I know.
But it's about what works. I mean, that's the end goal is like the patient. You want it to be efficient, you know. So, are these exosomes? Is that what they're called?
Exosomes.
Exosomes.
EXO.
Are they small enough to pass the blood-brain barrier
Yes,
if
they
you do
are.
them in an IV?
Yes, they are. Yeah. So just doing an IV, theoretically, I mean, I have no experience with it yet. I'm just starting to use it. But I spoke with Doug Spiel, who's the president and one of the scientific directors of Chimera Labs, who is they're the number one manufacturer of exosomes. And he's using it for all sorts of things. And he's getting, you know, according to him, I mean, I've yet to visit him. But I mean, I'm very impressed with what I've seen so far.
Oh, that's awesome. Especially if it's, you know, it's going to help people not have to take the extra time and expense to travel out of this country to get those same results, you know.
Right.
So I remember when I was looking into a treatment in, I think it's in a clinic in Guadalajara, Mexico. I forget the name. But you go and take one trip down, and then they extract your stem cells. Then you go back home for a couple of weeks. They culture them and multiply them. Then you have to go back down.
Right.
And I was like, oh, Jesus.
Yeah,
like, you know, that's a lot. It's a lot of work. So it sounds like this could eliminate some of that kind of hassle to the end user. And how does stem cell storage work? If, you know, say, you know, I have a baby and I have those stem cells extracted from the umbilical cord. Can I have those frozen until the kid is 65 and starts to get a bad hip and then use those really nice young stem cells?
Well, it depends on how things are when the kid's 65.
If the world even exists still.
Yeah, precisely. Yeah. It's hard, you know, currently, if you saved your child's umbilical cord cells, you would only be able to take them out and use them if it was for a very specific condition. Usually it's childhood cancers. There's a very short list of conditions that you can take them out of a stem cell bank for that purpose.
Oh.
Unfortunately.
In other countries, can you bank them and go use them for whatever you want, whenever you want?
It depends on the country.
Right. Okay.
Sure.
So each country has its own little set of rules. And are younger stem cells better? Like if I were to have mine extracted today, store them at 47, and then I'm having issues when I'm 95, are those going to be quote unquote stronger and more effective than getting them taken out when I'm 85?
Yeah, you bet. Yeah. I mean, there's still a lot we don't know. And what we really don't know is the risks associated with using allographic cells, with using somebody else's cells, the long-term effects. However, yes, I mean, for the short term, for the paracrine effect, for the cell's ability to harness the healing power of the cells they come into contact with, yes, absolutely, they're far more robust.
Interesting. And then what about cross-species stem cells? I remember when I first found out about stem cells, I was working with a health coach at the time, and human stem cell treatment, this is going back, 10, 15 years maybe? Yeah, maybe like 15 years. And I'd never heard of getting them from your own body or any of that. Maybe it existed. It was off my radar. But he was recommending that I go to this clinic in Tijuana. It sounds suspect already. And I told my parents, they were like, no, bad idea. But I believe it was either sheep or goat or pig, one of those animals that was sort of biocompatible with, you know, human DNA or whatever, and that you would get stem cells from the said sheep or whatever. Does that still a practice? And is there any?
I don't know that it is still a practice.
I mean, have you heard of that?
I know I've heard of it for some cosmetic products where it's a cream and it's got sheep stem cells or apple stem cells or something like that.
But not injecting them.
No, I don't think it's regularly done. However, I mean, theoretically it works because what's interesting about stem cells is they modulate the immune system to an extent that they actually suppress they suppress like an inflammatory reaction. So they are actually invisible to your own immune system. One of the main indications,
so
like one of the
so
best.
They're kind of cloaked. They just slip through. And
one of the conditions that stem cell therapy has been studied very closely is organ transplant. So when you get an organ transplant, the biggest risk is that you're going to reject that organ. Well, if you administer stem cells at the time of the organ transplant, it can suppress your body's urge to reject it.
Interesting.
Right. So theoretically, I mean, I have seen scientific papers using human stem cells in mice, and there seems to be no problem. It's never been studied formally the other way around, using mice stem cells in humans.
Right. Yeah. I mean, it sounds draconian and scary, but I mean, it's like we were talking about this before we recorded. And I've gotten so much feedback from people as I come out here, like, "Oh, be careful, this sounds dangerous." I'm like, "What are you talking about? Like getting, heart surgery like you had, or
hip replacement.
Yeah, hip replacement, chemo. I mean, the other interventions that come later after issues like I have go unresolved for a period of time are way more radical, way more extreme, way more dangerous. To me, this area of medicine seems, I mean, I'll admit I'm a little nervous about today. I'm breathing through it. But this seems way less invasive generally than so many of the other interventions once something has become debilitating, or you're dealing with, chronic disease or degenerative disease, things that are going to kill you soon, So I feel really good about it. So in terms of what we're going to do today, give me some, I want to ask this, but I don't want to ask this. Like, I kind of just want to go under anesthesia and have no idea what the hell
Which is exactly what's going to happen.
Any of you are doing. But for the sake of the audience, you guys, I'm going to take one for the team. And I want to find out the mechanics of like what Amy's going to do something different, but what you're going to do. Like when I fall asleep, I go into, would you call it, the basement?
Yeah. So you're gonna, first thing you're gonna do is you're gonna lay on the table. Okay. We're gonna have you change into our outfit.
Yeah.
Then we're gonna have you on the table. You're gonna get a tiny little needle in your hand, and then our anesthesiologist, who's gonna be here shortly, is gonna say, "All righty, Luke, count backwards from 100, and you're gonna get to about 96, and you're gonna wake up 2 hours later, and we're gonna be done." That's going to be your perception.
Right.
My perception is you're going to get to about 96, and then you're going to be asleep. Then I'm going to do a liposuction. I'm going to take fat from your love handles.
Ah, damn, not the gut, huh?
I like to take it from the love handles because if we take it from the gut, you get all the swelling afterwards, and it travels down into your scrotum.
Oh, yeah, no, I don't want that.
Nobody likes that.
Yeah.
There's probably a couple of guys in Berlin who likes that. But most people don't like that.
Swollen scrotum does not sound like what is on the menu for me. Okay,
right.
Okay. So love handles, I got those. I got a little spare tire. What do they call that? Muffin top? I got a little muffin top. That's cool. Okay.
The medical term is jelly donut.
Oh, yeah.
Yeah. So first we're going to do that because the fat takes longer to process.
I see.
So we take the fat first, then we take the bone. And that's, again, the big frisbee-shaped bone in your hip, your ilium.
And how do you get that out? I'm picturing like you get out like a drill that you get at Home Depot.
I used to use a drill. Now I use a bone needle and what we call a mallet, a dental mallet.
Okay.
Tap it in.
Okay.
Again, sounds and looks a lot scarier than it actually is. Yeah. And I use X-ray guidance, so I can see exactly where I'm going. There's no question. It's 100% accuracy.
Yeah, you're not like hit it with the mallet, clunk, and you're like, oops, let's do that a few more times until we hit that marrow.
Right. Again, I've done over 4,000 of these, never had a problem.
Awesome. Okay.
Then we've got a little break in the action while we prepare the cells, the fat cells.
And I'm just in la la land.
Well, you're asleep.
Yeah.
Okay. You're good. Yeah,
okay.
Very good. Then I start prepping for. We do the disc injection first. That is the most has to be perfectly sterile. The intervertebral disc is the least vascularized tissue in the body, so it has to be perfectly sterile. First, we'll inject the discs. Then I'm going to do epidural injections. Those are stem cell epidurals, not steroid epidurals. The reason for that is whenever you have disc pathology, frequently where the disc interfaces with the spinal cord or the exiting nerve roots, there's either adhesions or there's prior chemical burns. I mean, there's problems there as well. Then we're going to do the ligaments of your back around the facet joints, around your SI ligament, your iliolumbar ligament. Then we're going to treat your hips, especially your right hip, which is your problem hip. And I'll have to, your chart's in the other room. I can't remember if we talked about anything else. I think that might be it.
Left shoulder.
Right. Yeah. That's sure.
Which I don't know what the hell that is. Yeah. It just burns a lot.
I should have looked at, we'll look at it with the ultrasound. We'll see if there's anything wrong.
Cool.
Yeah.
Okay. And then while I'm still out, you step out, grab some lunch or whatever, and then Amy does her thing, which I'm going to talk to her about momentarily.
Yeah.
Okay.
Amy works her magic.
Interesting. And then what can I expect as I leave here later today and walk across the street to my hotel?
19 out of 20 people. Whenever we inject, so first we'll just talk about without the discs. So if we were just doing the epidurals in your back and your hip, you just, might be a little stiff and sore. You definitely can feel where I took the fat. You can feel where I took the bone marrow, but it's just, compared to what you're already going through, it's just mildly uncomfortable. It's no big
Cool.
deal.
I'm already used to being uncomfortable.
Whenever we inject discs, 19 out of 20 people are fine. They're a little bit stiff, no big deal. 1 out of 20 people, wax them for about 3 days.
Okay.
Yeah. It's,
I don't think I'll be one of those.
I doubt you will be. Usually it's the real young guys. Usually it's the guys with really thick annular capsules. And those guys, if that happens, it doesn't negatively impact their outcome. It doesn't mean they're going to have a poor outcome. It just means it really sucks for them to go through.
Right, right. In my case, it would just mean I would have to hang out in lovely Park City for a couple days and watch Netflix.
That's right.
Okay, cool, man. Well, I'm excited. Thank you for the information and the interview,
bet,
man. It's
bet,
great to
Luke.
meet you and to come out here. I
likewise.
feel like I'm in very good hands. You seem very competent.
Well, we
and
love what we do. You can see it on the faces of all my staff. We
Yeah.
actually enjoy what we do.
I can tell that. Yeah, I can tell by your enthusiasm. And I enjoy learning from people like you. So thank you so much.
bet.
In closing, since I've learned so much from you, as has our audience, who have been 3 teachers or teachings that have influenced your work in general or just your life that we might go to learn more?
Oh, well, all 3 of them are people who don't have any content on the internet, or they're just people in my life.
Okay,
So,
well, give them a shout out. Maybe they'll hear this someday.
well, the late Rick Marinelli, who I'm very sorry to say passed away from throat cancer, who was my mentor. Terrific man. I'm very sorry that he's no longer with us. I wish he could see everything we're doing now. Certainly my dad, Warren Adelson of Adelson Galleries. And I would have to say my brother, Adam Adelson of Adelson Galleries of Boston.
Awesome, man. Thank you. That's funny. Sometimes people are like, Gandhi, Jesus, Martin Luther King, Eckhart Tolle, like a spiritual teacher's thing. But you'd be surprised how many people is like immediate family and people that they just love and have
and then certainly
my
wife Indira and our 2 beautiful girls, Beatrice Bodicea and Vicky Wynn. I mean, those are my 3 biggest teachers. I suppose those are my 3 biggest teachers right now.
I bet.
Are those 3. I've got a 2-year-old and a 4-month-old and a beautiful wife.
Wow.
Taking care of them. So
awesome, man.
I just love it.
Awesome.
Love it.
All right. Well, thank you for everything. In closing, where can people find you, social media, websites, any links you want to give out?
Easiest is the website, docereclinics.com, DOCERE clinics, one word, docereclinics.com. We're on Facebook, we're on other stuff too, but the website's the go-to place.
Awesome. Perfect, man. Well, thanks again.
All
And I'll see you on the other side.
That's right.